Okay, so this is Bridget Walsh from the Schuyler Center for Analysis and Advocacy. And I want to welcome you to this webinar, Moving on Maternal Depression Project, focusing on racial equity in maternal mental health. We want to thank you all for taking some time from your very busy schedules to join us today for this conversation. I am a senior policy analyst at the Schuyler Center in Albany. This project is exciting because it's a collaboration among a number of state agencies and organizations representing providers, advocates, and women who have lived experience with maternal mental health conditions. The lead on the project is the Office of Mental Health, and our partner in Washington providing technical assistance and connecting us to the rest of the states involved in a learning collaborative is CLASP. And the Schuyler Center is pleased to be the coordinating agency for this project. This meeting is being recorded and will be posted on the Schuyler Center's website following, hopefully tomorrow, but following the webinar. The Moving on Maternal Depression Project is part of a national learning collaborative, which is getting technical assistance from CLASP. The purpose of and the goals of the project are to advance policies that improve prevention, screening, and treating for maternal mental health conditions. We're focused not only on maternal depression, but also on a broader range of maternal mental health condition. And built into that is an emphasis on racial equity and culturally relevant services and practices in both policy and systems change. And so that's really a lot of the work that we want to be doing today, is that focus on racial equity. There are 3 states receiving in-depth technical assistance. In addition to New York, New Jersey, and Pennsylvania are part of our group. And then there's a broader learning collaborative with many other states that join in on calls and conversations. So the goals of our project is looking at key metrics and data. How can we better measure maternal mental health conditions in New York? We want to be able to better understand the scope and location of screening and treatment services, and how can we build better systems. And we want to integrate policy across state agencies and communities. There's a lot going on in a state like New York. We want to make sure that we're staying coordinated and integrated. And we want to really build in, and we are building in, the experiences of women. We have a Voices work group who's working specifically with women to bring their experience into this work, and also to integrate racial equity across each goal. And that's the focus of today's presentation. Many of you might have attended hopefully you attended the webinar we did on Monday with Dr. Martine Hackett from Hofstra. So with that, I'm going to turn this over to Wilma Alvarado-Little to talk a little bit about the presentation on Monday and to set up today's conversation. Wilma is the Associate Commissioner and also Director of the Office of Minority Health and Health Disparities Prevention at the New York State Department of Health. So Wilma, I'll turn it over to you.
Oh, thank you so much. So thank you very much, everyone. As Bridget had mentioned, Martine Hackett was a facilitator for the webinar earlier this week. Dr. Hackett is an associate professor in the Department of Health Professions at Hofstra University here in the state of New York, and the director of the Master of Public Health program. And her research and community-based work focuses on maternal child health, suburban health equity, and the intersection of health and housing. And during her presentation on Monday, she gave some examples regarding some of the challenges, or the equities and inequities, rather, of some of the communities who reside in the suburbs versus the city. She's also the co-founder of the Birth Justice Warriors, which is an organization committed to eliminating Black maternal and infant mortality in Nassau County. She had previously served as a deputy director in the New York City Department of Health and Mental Hygiene's Bureau of Maternal, Infant, and Reproductive Health, and she's also had a decade of experience as a television producer. Her credentials include a BFA in film and television from New York University, an MPH from Hunter College, and a PhD in sociology from the CUNY Graduate Center. And so she was able to provide us with information and provide an overview of racial equity And so for purposes of our meeting today, what we can talk about are some definitions. And one definition we want to be able to share with you is the Center for Law and Social Policy, their definition of racial equity. And that's the condition that would be achieved if one's racial identity no longer predicted in a statistical sense how one fares. And so we wanted to make sure to share this information with you because what we have found is that some folks use the terms racial equity and health equity interchangeably. And so we just wanted to be clear that that this is looking at, as Bridget had said, we're looking at how to infuse and integrate racial equity across all of the goals, not only of this project, but also of the work that we do. So for this piece, for this second webinar, as Bridget had said, you know, the idea of this is for folks to, you know, hopefully after either participating or watching the first webinar, how can, you know, where is our conversation going to take us? And we do have a framework involving conversations to help guide it. Just want to share some of these thoughts with you because we also want to gather input on how we could build resources and medium to help with racial equity and what's the role of different stakeholders in addressing these issues. And what roles can advocacy and professional organizations play to advance racial equity, and how do we operationalize this so that there isn't a disconnect between the practice and the policy or vice versa. We really would like to generate input from the wider community and look at this from a policy analysis perspective and what tools are we going to need to develop and or provide so that we can continue to move that needle forward. And so, Bridget, do you want me to turn this back to you? Or how would you like to go about this? Or I don't know if if folks on the call have any questions at this point.
Okay, so I am going to keep everybody unmuted since it's a small group. And if you need to mute yourself because you're moving around or something is going on, go ahead. Or I can mute people if it starts to get too loud. But I think what I'd rather do is have a conversation. So thanks, Wilma, for setting that up. Maybe since this is a small group, if anybody was on the webinar on Monday and wanted to give us their reaction to what they heard, or if they had any comments on Monday's presentation, that might be a really good place to start. And then we can jump into a set of questions that we have for you. So is there anything, any comments about Monday, if you were on the webinar? Okay. So one of the things that we were trying to get at, one of the things that our equity work group wanted to get at is for programs who are already operating maternal mental health programs and working with people out in the communities, what are you doing to address equity, racial equity in your programs? Are there any things that you're already doing that you think help address this that we should know about? Any best practices, any thoughts you have about what is working in your program? We'd love to get a sense of that. Hi, Catherine. Just letting you know, Catherine, that we're allowing people to just be unmuted and participate in the conversation. So feel free to keep yourself unmuted. So what we're looking at, you jumped in right at the end here, is we're trying to gather some feedback from folks about what's going on. And so we're going to lead you through a few questions here. And one is, we just want to know if people out in the community are already addressing some of this in the programs that you're working in. And if you have any ideas or thoughts for us about what you think is working in your own programs to address equity. Any thoughts anyone has about even if your program isn't, or programs you're working with aren't addressing equity, what they should be doing? Maybe to include equity as a component of their work? Folks are unmuted to the most, so feel free to just jump in and we'll try to facilitate a conversation since it's a fairly small group. Also, there is a chat box, and if you do chat, you'll notice that there's a little bar that says "to." So you can, if you have anything you want to include, you can just chat to the entire group if you want. Make sure that everybody sees it if you'd rather just type something in chat. But other than that, folks are unmuted to have a conversation. All right, well, maybe we'll come back to this one if people want to give some thought to work that you're doing on equity. And we'll move to another slide. And so one of the other questions, what we'd like to get at from folks that are working in these programs is, if you haven't addressed equity yet in your program, what do you need to sort of get at it? Are there supports or resources that you feel would be beneficial to you addressing it? More education, more toolkits? How would you like to see that happen? Are there things that need to be, that we can do to start advancing this as we start to think about rolling out public policies, or how we incorporate equity into public policy? How do we make you aware and your programs aware of addressing these issues? Any thoughts or suggestions? Anything you've wanted to try or thought about trying that you haven't been able to?
Bridget, this is Catherine. I have recently taken, I don't know how many New York City folks are on. New York City, the Sexual and Reproductive Justice Unit has been conducting training, so it's trauma-informed, trauma-informed resilient systems, which includes implicit bias, but the main focus is on resilience training, and also focuses on the structures. So it's like a 2.0. So once you think about your own individual biases, you have implicit bias trainings, and then you start thinking about what the next step is, right? And we all talk about how we have to get to that systems level. So this really focused on how do we create trauma-informed and resilient systems. So how do we focus on putting these things into practice at a systems level? And I got to take the 2.0 version that they have. They kind of revamped it from all the feedback from providers. And I thought it was a really good, well-rounded, evidence-informed kind of training that created a lot of thoughtful thinking and engagement. I don't know how realistic it is for everyone to take it, but I thought it was a great, and I've taken several different types of trainings, but I thought it was a good way to kind of introduce a topic that's a little bit more complex beyond the basic training that we typically receive.
Do you know who sponsors or puts on those trainings? Is there a curriculum out there that people use or purchase, or is it something that was developed?
So yeah, so New York City developed it in conjunction with Trauma Informed, which is it's out of California, and I'm forgetting exactly where in California, but they did it joint. So it was they took the Trauma Informed curriculum and then created a more specific, and it wasn't even New York City based, but it was more informed by what all the New York City information that's kind of come in through all of their birth justice work and their community engagement groups. And so that's really kind of helped inform the more complex training that's been created. So there is a set curriculum. They just started to train the trainer model that's being rolled out into all the H&H hospitals.
Okay.
That sounds really interesting. Is it possible to send information about that?
I'd have to ask, because it's not mine, and I'm not sure. I mean, I know they're happy to talk about it, so
Yeah,
I'm definitely happy to ask.
That'd be great, Catherine. If we had a contact for that, that would be.
Yeah, the contact person is Kelly Davis, and I can definitely, she's more than happy to talk about it, I know. So I can definitely share that.
Okay, for those of you who just joined recently, we're having an open conversation here about, as a follow-up to the webinar on Monday, and we're looking to get some feedback from the wider group about some things that we can be thinking about as we move towards sort of strategies and recommendations on policy to make sure that we're incorporating equity. And so I'm going to go back to the first slide, and just to see if anybody that just joined us wanted to talk a little bit about what they're doing in their own program to advance equity that they think is a good model or something that we should be thinking about, best practice. See if there's any other comments. And people are, you're unmuted at my end. You can mute yourself if you're not talking to sort of keep down the background noise, but you're unmuted, so feel free to just chime in since it's a small group. Anybody that just joined us have any comments about something they'd like to share that's been working? Okay.
I can offer a little bit from class perspective. Just,
Sure, Shiva.
I'm not sure how familiar everyone is with what we do on the call, but some of the things that we do throughout our organization, one of the most basic ones that I'm sure most of us are familiar with is just trying to disaggregate data whenever possible so that we can look at trends and inequities. But then I think the most important approach that we take to advancing equity is really looking at where we are in relation to our work and trying to use different screening tools and through different methods, just trying to see how different policies and policy proposals differently impact different populations and demographic groups, and then doing what we can to bring voices of different communities and affected populations to the policy table and sort of throughout the policy-making process. Those are some sort of broad strokes, but that kind of demonstrates how we work to integrate racial equity into everything we do.
Thank you. That's great, because I know that your work has been instrumental in informing, helping us with the MOMD project and giving us resources along these lines. So that's great. Thanks. So I'm going to go back to this one. Anybody else have any suggestions on what would be useful to help people incorporate more into the work that they're doing? And sort of going along with that, our next set of questions is, as we're thinking about maternal mental health, what roles do you think various parts of the system can play to advance equity? And how do we operationalize this? Where do you see different roles in terms of support, training, information, ensuring that equity is infused into policy and resources management? And any thoughts of what some of this looks like?
Bridget, this is Wilma. I just want to share a little bit of what the Office of Minority Health is doing, and maybe this may be of interest to folks. So the Office of Minority Health here with the New York State Department of Health, we're a legislatively mandated office, and part of our charge is to excuse me, part of our charge is to address minority areas, and the minority area is a federal definition, and that's cities or towns or resources that service or have a 40% or greater non-white population throughout New York State. And so when we're looking at this, what we do is when we're mapping out the areas based on the data that provide this, that for the areas that resonate with this definition, this is where we, in part because of our legislative charge, will reach out to the communities regarding funding opportunities, because there's certain responsibilities that are legislatively mandated regarding funding within the minority area definition. The other piece, though, is it's not just because it's defined as a minority area. Also, too, what we look at is from the health disparity perspective. And so by looking at these variables, it's helped us identify opportunities to address some of the racial inequity communities are experiencing. So there is from the Moving On Maternal Depression Initiative that you folks are spearheading and funded by CLASP, and also working with the Office of Mental Health. I think there's opportunity to be able to look at the racial inequity in that perspective. So this is something that we as New York State Office of Minority Health does, looking at the not only the racial inequities, but also to some of the other pieces that contribute to that based on the data that help us identify those areas based on demographics and priority areas of our prevention agenda as well.
Great. Thank you. I'm not sure everybody understood your role, so that's useful. Thank you. Anybody else have any comments on any of the questions? Anything they want to contribute, other programs they'd like to share with us?
Bridget, this is Kate from OMH, and I don't actually have anything to contribute. I've been really interested in what other folks have been adding, and I was curious about what Shiva was talking about, using screening tools, if he could say a little bit more about that tool, what tools they use.
Hi, so I included some of them I sent the New York MOMD team a memo about sort of different racial equity principles and practices, and I shared a couple of a few tools that different sort of states and localities have used to screen their policy proposals. Yeah, and just it helps sort of analyze how policies can impact different populations.
Super, thank you.
Shiva, are those resources that we can post on our website?
So we had a meeting today. I think that we are comfortable with you all sending it out, but I think that we'd rather it not be on the website right now.
Okay, so I can send to anybody I'll give you my email in a minute. I can send to anybody on this meeting today. Okay, that's good.
Yep.
So with that in mind, one of the things that I would say, and it's just because I don't have the experience in using that and looking at it, that would be, for me, that would be a useful thing to go through an example using that tool, using one of those tools, to go through an example of how you use that to look at a policy.
Okay.
Hi, this is Kendra.
Hi, Kendra.
Hi, just going back to some of the things that that we do from a policy perspective. I mean, we're really starting to take a look at maybe reading levels and a translation of documents to other languages, and how those things really affect the policy itself and the dissemination to to the right groups that it needs to get to. And that's something that I think that has really evolved over the last, I've been here 6 years, and I think we're just more aware of that now and trying to incorporate more of that. So something little, but.
That's not little, that's a monumental challenge. And I think one of the things that it would be really nice if we could sort of work on with the MOMD project is, I think this came up once before, is getting a sense of who has already translated some of the materials around maternal mental health into various languages, and seeing if there's ways we can share that so people don't have to go through the expense of, you know, getting things translated again if there's already resources that are available. And so I think, you know, that's something that, you know, sort of in our a back burner issue, but I think when you're talking about equity, making sure everybody can access in their own language is important. So I think we'll take a look at that. Thanks.
Perfect. I made some good connections too yesterday. I was at the Day of Honors over at the plaza, and there was some folks that actually were speaking about the translation services that they offer and how they're willing to help with some of that. So I haven't had a chance to explore that any further. It was a brief conversation, but may have some resources there.
Great.
It'd be interesting this is Wilma, it'd be interesting to, I don't know if we can have a show of hands on the chat box, but if you know who has had to provide, or who have worked with individuals within their organizations where this is a request, right? Because sometimes with language access and the translation of tools or resources, one might feel like you're the only one doing this, and it can sometimes feel a little bit overwhelming. So I'm just wondering if there are other folks on the who have had situations where they've had to navigate providing services in languages and cultures other than U.S. based or English. Just a thought.
Anybody want to comment on that?
This is Catherine. We run into that issue all the time. I mean, it's easy for most of our stuff is translated into Spanish, and even for most of my partners that I work with one particular group that does trauma-informed and psychoeducation work with immigrants or people who are trying to attain their visas, or who are not documented in Queens. So we have a lot of our stuff, and a lot of their stuff is bilingual. But I think when you start talking about other languages, that's where it starts to get tricky, because those are harder. And the other thing I would say is when we translate, and there's a lot of research on the international stage around translating mental health materials and what that means and how you do that effectively into other languages, because clinical stuff is hard enough, but when you start trying to talk about like feelings and how things are feeling and how to recognize that, it becomes very tricky from language to language, and it's not a simple translation, and oftentimes it takes a lot more effort. So there might also be stuff that we use that's already been kind of not only literally translated, but actually culturally translated on an international level. So there are a lot of groups that work on this that do it on a regular basis. So some of in Queens, a lot of the work is in Bengali, and I can guarantee that, we can get a direct translation, but I know that people have done Bengali translations of mental health materials who work, in the actual original country. So thinking about that too as one of the challenges with mental health and with screening materials. And there was recently a article that came out that talked about how screening material, and this was not even this is for African-American women. So, but that it wasn't cultural, in a sense, there was some cultural differences between the way it had been drafted out, and it wasn't catching, it wasn't appropriately screening people. and how that was a challenge and how we have to consider that as we move forward as well, and kind of roll typical screening materials out.
Absolutely. This is Kendra, and we ran into that over here too when we had some items translated. We had folks read them who it was their native language, and it didn't make sense. It lost something. So that was a challenge.
Okay. Are there any other supports or thoughts about how we do this? I mean, I know there's been a lot of conversation about different training programs. How can we be thinking about what assistance we might need to roll things out, or is there some utility to having some training programs be prioritized over others, or training programs that might be endorsed more universally by the state or state agencies that we would recommend that people have when addressing equity issues? I'm just trying to think, about is there some role of standardizing some curriculums so that we know that all people operating, or many people operating or being trained in maternal mental health, are at least have access to some similar curriculum? Or does equity issue not lend itself to that type of thing?
I think that's a hard one, Bridget, and I think, and this is, I think, the struggle in the health equity realm is that I don't know if there's one. Another potential area is focusing also, I think implicit bias training is a standard, but I think thinking beyond that, maybe structural competency training, there's structural competency trainings, there's anti-racial anti-racism trainings, there's there's trauma-informed, there's resiliency, there's trauma-informed and resiliency, there's a wide array, there's the historical component as well. And I think the hard part is that I haven't seen one, and I think this is what we're also running in with OBGYN, like I haven't seen a one that you can say to everyone, that's what you need to take. I would say that probably the closest one is the one I just took with the New York City Department of Health, but most of them, it's like a multi-pronged aspect, that I think, and I think it's important for those who are interacting with the maternal mental health to really understand kind of the layered component,
Okay,
but it's hard then to require it.
Yeah. So if that part of it becomes the difficulty, how should we be thinking about policy development or program development in a way that bakes some of the equity issues into it, or sort of at least the expectation of training into program development, or into the types of programs that could be funded? I'm just trying to think of where do we actually sort of infuse this and make sure it becomes integral into programs, and then giving them the resources they need to have these conversations. Okay, that seems to be a hard one.
Mm-hmm.
Yeah.
Well, this is why we were hoping for a little collective wisdom from you all here about what kinds of things we need to be focusing on. I don't know if there's any if anybody else has other, wants to weigh in on any of these other questions, or whether, we can, take some of what we have here and start to continue to have these kinds of conversations. And as we start to think about structures and policies, maybe there's more that we can be, focused on in this area. I mean, I like the idea of having some sort of tools to help people understand if they are looking at equity appropriately. And so maybe it's a question of ensuring that people have the right tools, and that when they do want to address issues, they know where to go to get the appropriate trainings and suggestions for how to do that. For people, maybe this is a question, for people who are running programs, if you've wanted to address this issue, where have you gone for assistance? Is there any resource that you have relied on in particular for the information that you use?
So this is Catherine again. I'd say, I think initially when I started doing this work, I looked at a lot of the resources that are out there and the tools that are out there. And I have to say, the reality is that I sort of got, the realization kind of came to me when I was talking to community members and talking to individuals who utilize the services, that I was still not understanding. And I think that the actual resource that has really kind of set me right was actually having individuals and community members engaged in the process from the very beginning. Because even trying to get your mind right around saying, like, because I know Washington has a toolkit that I initially was told to use on, I know that there are tools out there, and I know that there are toolkits out there. I know that's our gut reaction. And I do encourage people to look at those, but I really do think that if an organization or if a institution wants to change, they need to be talking to those people who are actually utilizing the services, because they're the ones who are going to tell you how you should be measuring, what you should be measuring, what they consider as quality. And I almost feel like that's more important than having a toolkit, because those are the people who are going to be like, you're doing it all wrong, or here's what you need to understand why I feel this way. I've talked to a ton of women who said, like, they took that effort. They found a provider, and that provider treated them horribly. They didn't understand. There's such a lack of mental health care providers in general, never mind folks who focus on the maternal side or on postpartum, that, women were like, the person didn't understand, they had no respect for what I went through. And then, so then they were out on their own again. I've talked to some folks in Philadelphia, and they were saying, we have more people kind of coming in to utilize our services, but now we don't have enough staff. So we're experiencing staff burnout because that staff can't keep up with the demand. And so, we talked about, should it be a marketing change because they have more support groups that people don't utilize, because now there's this sense that the gold standard is only individual care, which could be perfect for someone, but maybe you don't need that. So I don't know. I think that's also another option is who our messengers are and what's the marketing that we should be talking about, and who should actually be sharing that message. Is it a nonprofit? Is it a state? Is it someone else? I could talk forever on this topic, so I'm trying to control myself. But
yeah.
I think that there's a lot of, I was at and I feel like I'm being New York City focused, and maybe that's where my mind is today. But I was at the Maternal Mortality Review Committee meeting on Friday, and one of the main recommendations was raising awareness around maternal depression. because there were several several deaths that had been indicated around mental health. And the challenge then is there's a lot of fear around even utilizing those services for folks, because it's an immediate call. If you're deemed unfit, it's an immediate call to CPS, or and what that means for you and for your family and for your children. And so there was that fear around that. There was a lot of concern that even family and individuals within the family didn't see the red flags when they were there. So I think there's also education that has to be done around that. But again, who's the right messenger for that? And who's going to actually listen? Like we talked about, a lot of people will listen to maybe it's their friend or a celebrity, or it's certainly not tweets from New York City DOH.
Mm-hmm.
So I think there's a lot to consider in those conversations. And there's postpartum doulas. So I could go on and on.
Hi, this is Kendra. Additionally, we also did reach out to, or have been, for many of the policies we've been working on, especially around maternal depression, we did reach out to other providers and folks in the community and other Medicaid state programs to learn best practices, what worked and what didn't, and tried to avoid some of those pitfalls.
Mm-hmm.
Yeah, I'd say on the policy level, I think it's definitions for folks, especially when it comes to reimbursement and data, disaggregated data, and access to data. Like a lot of those records sit in different departments and aren't always exchanged. So, as we start reviewing records of folks, like it's not easy to kind of get records and exchange records. And so that's something that we also might want to consider, as we think about the bigger maternal health world. And, maybe the standard referral that you would think that's where it would come in from isn't where it's coming in from. And so how then do you exchange records and ensure that everything is HIPAA protected but available? I'm sure there's some policy wording that's needed in there. I just, haven't gotten into the weeds. And also requiring disaggregated data, because sometimes people don't do that. So you might also.
That's a great point. That is, you said that again. We've heard that before, and we know that that's a complicated technical issue to address. The records piece, especially with HIPAA compliance. But I'm flagging that one because, it's one that has come up several times. So for multiple reasons, equity being one of them. But continuity of care, warm handoffs, it's the whole number of things that are engaged with that records exchange. Okay. All right. Is there anything else anybody would like to add? I'm not going to keep people if.
And this is Wilma. I just think it was a really good point about asking people what resonates with them and including them in the process from the beginning. Because I think that, something that doesn't sit well with the communities is when somebody tells them that this is their need instead of what they have identified as a need, right? So we don't go in there saying this is what we think you need, and them feeling, no, that's your need for us, that's not our need. So I'd like to hear a little bit about some community engagement processes that some of the organizations that have been participating in this initiative have utilized, because I think that might be of interest and of value as well.
Okay.
Bridget, this is Sonia Murdoch with the Postpartum Resource Center of New York. If I may share a few examples.
Sure.
Okay. We fully agree with a few of the participants who have said, and even Wilma right now, the importance of making sure women's voices are included and that we listen to them. And some examples when we go into a community is when it comes to racial equity, particularly with Black moms. So we look to collaborate with who is the group in the community representing those moms. So, for example, working with groups such as Mocha Moms or the PAM Project, and then working together to host a local educational community event when it comes to maternal mental health, particularly co-hosting Dark Side of the Full Moon screenings, and then having a community panel discussion and a group discussion, and further identifying what the gaps are in the communities and then working together to solve those gaps. Another example, which is, we believe, very unique, we had an intern who actually from Monday's webinar presentation, Dr. Martine Hackett, we actually had a student who was a student of hers who interned with the Postpartum Resource Center of New York. And we were very grateful. We worked together in a collaboration with, a college sorority that was made up of young Black women students. And we put together an educational event for college students on maternal mental health. So looking to educate those young women very early on to be educated about mental health, but also further learning about their risks if they go on to become mothers or parents in the future. And so that's another example that was shared then on a local level, but then got shared through their communication channels nationally with other college sororities. Also, way back at the Resource Center, we were one of the first in the country to actually do a segmented maternal mental health awareness campaign, particularly towards Black mothers. And it was a collaboration with United Way of Long Island, the Suffolk Perinatal Coalition, EOC of Suffolk County, and it highlighted the Postpartum Resource Center of New York statewide helpline. And we all worked together with this campaign, and we found that it was very successful with breaking down stigma, as well as increased the knowledge of a safe place for these moms to reach out and contact and get connected to help. We were very happy that the New York State Department of Health, when we shared our poster campaign with them, that their maternal depression campaign that they had then was inspired by our work with that awareness campaign. And then we also go into communities and working with coalitions that particularly are working with Black mothers with training doulas and working with them on cultural compassion with the moms and identifying special needs of moms in the communities, and all working together again to make sure that these moms are getting to the help they need. So those are just briefly a few different examples. Oh, and lastly, I should mention that on our statewide resource directory, we've also have included, we were able to reach out, there is a resource called Therapy for Black Girls. So we've included them now in the statewide resource directory. And the more trainings that we're doing, we're looking to collaborate with local foundations that will further help provide training scholarships so we can further build those resources that will address Black moms currently and make sure that they have access to quality resources when it comes to maternal mental health treatment and support services.
Well, that's great, Sonia. Thanks for sharing all that.
Mm-hmm.
That's a
You're
lot.
welcome.
That's
welcome.
terrific. I'm hoping a lot of people were taking notes like I was on that. And so I think what I'll do is I'll invite anybody who has resources that they would like to share to send them along to me. I'll post my, there's my email address. We are going to post today's recording and the recording from Monday, along with Dr. Hackett's slides and any other resources people want to share on the Schuyler Center website, which is scaany.org, under our maternal depression page. And I should have put the link up there, but I didn't. But if you go to our website, you'll find a drop-down menu, and then you'll see a maternal mental health page. And these resources will be up there tomorrow. So if there's anything you'd like to send, either today or in the future, we'll add it. We'll keep adding to that resource page. They don't have to be individual resources. If there's a link you'd like us to send, that would connect people to another set of resources, we can do that. I don't want to recreate really good pages somebody has out there, but if we can put links all in one place for people that are coming to get information on this project, we can do that. So feel free to send things along to me, and the recording for today will be up hopefully tomorrow. Any other thoughts or questions or suggestions before we close? Okay, well, thank you all for coming, and we appreciate this. And there's my email address. Please feel free to reach out and contact me at any time with any other thoughts or suggestions you have. And watch your email. We'll be doing more of these webinars in the future. Thanks so much. Bye-bye.
Bye-bye.
Thank you.
Thank you.